Hello everyone, my name is Yu Chen, an assistant professor at the Vanderbilt University Medical Center. Today I'm going to discuss the challenges and opportunities for teamwork and patient safety in intensive care units. This is a collaborative work with Dr. Gong Yang from UT Health. Intensive care units are highly collaborative, and at the same time, they are stressful environments. In ICUs, usually demands exceed available resources, which will increase clinician workload. Also, clinicians need to conduct multiple tasks simultaneously, process overloaded information, and their works are interrupted by other clinicians due to emergent situations. Teamwork plays an important role in intensive care, and it requires clinicians to reach a shared mental model to improve health outcomes and patient safety. However, the stressful work environment can break the shared mental model, which can lead to ineffective and inaccurate communication. Therefore, developing high-performing teams without the break of the shared mental model has the highest priority in improving patient safety, especially in highly collaborative and stressful environment, such as intensive care units. Here is an example to show user EHR and user interaction which were broken during a care of a patient in a state of confusion with severe hyponatremia. At the beginning, a nephrology consultant reviewed the laboratory results and asked an intensivist to administer hypotonic saline immediately to increase the sodium level and recheck the sodium level in 1 hour. He didn't specify how much hypotonic saline should be administered. When the nephrologist came to the ICU 2 hours later, the patient's confusion had not improved. His sodium had risen to 130, a rapid increase that put the patient at risk of severe neurological complications. The nephrologist noticed that a 500 milliliter bag of hypotonic saline had nearly finished infusing. The infusion was stopped immediately, and the patient was administered medication to correct the rapid increase of the sodium level. Fortunately, the patient's sodium stabilized and his mental status gradually improved. When investigating the root cause analysis results, we found there were user EHR and user interactions which were broken during the patient care. So the nephrologist consultant asked the intensivist to administer hypotonic saline without specifying how much. So this is the interaction broken between clinicians. And they also asked the intensivist to recheck the sodium level in 1 hour, but the intensivist didn't check. So the intensivist ordered like the 500 milliliter infusion, and at a free test note, why they order like 500 milliliters? They should administer like 50 milliliter, but he didn't find like the 50 milliliter template in the EHR system. So he ordered like 500 milliliters infusion and add a free text note in the EHR system in the clinical note. But this clinical note was not read by pharmacist or nurse. So when pharmacist they filled the medication, they filled the 500 milliliters bag of hypotonic saline. And then the nurse administered like the 500 milliliters bag of hypertonic sodium, also without reading the notes. So there is a broken in user EHR interactions, and also there's broken interaction between users. So HRQ, U.S. Department of Health and Human Service and the Patient Safety Act have been collaborating to establish comprehensive unit-based safety program, which called CUSP, to ensure clinicians reach a shared mental model. CUSP focuses on improving safety culture, teamwork, and communication. The core CUSP toolkit is created for clinicians by clinicians. Each module includes teaching tools and resources to support teamwork at the unit level. The CUSP toolkit was applied to prevent central line-associated bloodstream infections in patients in ICUs. Around 1,800 ICUs used the CUSP toolkit, and they reduced the rate of central line infection from a baseline of 1.9 infection to 1.1 per 1,000 line days. Also, the Department of Defense and HRQ created TeamSTEPPS. TeamSTEPPS is based on 25 years of research related to teamwork, team training, and team culture. TeamSTEPPS borrowed ideas from crew resource management protocols in aviation. The experts identified 4 core teamwork competencies: communication, leadership, situation, and monitoring, and mutual support. These core competencies are encircled by the patient care team. Performance, knowledge, and attitudes are outcomes resulting from proficiency and on the core competencies. TeamSTEPPS has been reported as a successful tool for ensuring a shared mental model in ICUs. Tele-intensive care unit provides a great opportunity to improve patient safety in ICUs. Tele-ICU electronically integrates patients, bedside teams, tele-team, and a variety of medical devices with all aspects of care. The risk prediction algorithms and push notification dashboards embedded in the Tele-ICU platform enable a Tele-ICU team to watch multiple patients simultaneously, while on-site support is unavailable. Therefore, Tele-ICU team has a higher probability of capturing the timing of adverse events, which are not realized by the bedside team. In this paper, we proposed a potential tele-safety team, which could be established to monitor patient safety risk remotely. The benefit is such a team will have a low risk for the interruptions and a low risk to be affected by the complex physical environment in ICUs. For instance, a tele-safety team can monitor multiple ICUs simultaneously. However, tele-patient safety team or tele-ICU is still a long journey because it requires the policymakers, healthcare organizations, and insurance companies work together to make it happen. The video tracking technology can capture all clinical activities, team communication, and patient health data through audio-visual data, which provides a great opportunity to train computer vision models. The well-trained and tested computer vision models can be incorporated into the Tele-ICU platform to detect inefficient teamwork, such as miscommunication from medication prescribing to transcription, to dispensing, and to administration. Computer vision will detect adverse events in an automated way. Also, it provides a great opportunity to measure or monitor teamwork activities through audio-visual data. In the modern healthcare system, clinicians need to leverage health IT to manage patients. Electronic health record is a popular information system used by clinicians in their daily care, especially in the third stage of EHR incentive. In our paper, we propose to use data generated from EHR to monitor teamwork. Here are examples of user EHR interactions from EHR order log data. So each row is a event. That means a clinician A performed flow sheet data saved to EHR of the patient 1 at a specified time. So informatic tool can be developed based on order log to identify efficient and inefficient user EHR and user interactions. For instance, we use the network analysis to measure priority care structures through EHR order log data and test associations between care structures and patient safety, categorized by non-routine events. Beyond audio-visual from video recordings and EHR order log data, there are many other data resources which can support patient safety research. For instance, patient safety reports are the most frequently used data to identify risk factors of adverse events. First dataset is used to identify adverse drug interactions. Sample data is used to detect health IT-related safety issues. If you are interested in those data resources, you can use our provided information as a guideline to know details. ICUs present highly complex medical environments using sophisticated technology and caring for vulnerable patient population. They are breeding grounds for errors because interdependent components interact in unexpected ways. Miscommunication and a broken shared mental model are associated with medical error and mortality risk in ICUs. In this paper, we present opportunities to improve patient safety from prospective and retrospective perspectives. For example, we showcase the opportunity of using telehealth, computer vision, and audio log-based informatic tool to improve teamwork and patient safety. Okay, I'm going to take your questions. Thank you.